on Detox this morning, and we've got something I'm really curious to also understand. So I'll also be kumateres name makaterera ndichinyatsonzwisa kuti what exactly is going on in terms of this particular disease that we're talking about, substance use disorder. And from my understanding, it's a treatable mental disorder that affects a person's brain and behavior. But thankfully, I've got experts who will then help me to zero in on that as well. If you've got any questions, you can come through on our WhatsApp 0719100404, and feel free to be part of the conversation. Joining us in the studio for this particular conversation from Greenwood Wholesalers and Pharmacies is the Marketing Research Officer, Mr. Peter Kavia. Good morning to you, Peter. Thank you so much for joining us.
How was the weekend?
Weekend was heavy.
Yeah.
But I'm thankful I'm alive.
Yeah.
Joining us as well, as usual, is Dr. Deva. Good morning to you, Doc.
Good morning to you.
I'm doing well. How's your weekend?
Well, it was a working weekend.
Yeah? Always busy?
Yes.
Awesome. And of course, also joining us from the City of Kings in Kobulawayo is Sweni Ndlovu from Stop to Start Drug and Substance Abuse Rehabilitation Facility. Good morning to you, Sweli. Thank you so much for joining us.
Morning to you, morning to the listeners, morning to Peter, morning to Dr. Dale.
Awesome.
Morning to you, really.
So substance use disorder, how do we break this down, Doc, in layman's terms?
Thank you, Q. As it rightfully says, disorder, we've purposefully structured it as a disease. It's a disease of which is triggered by substance use. In simple terms,
that's how simple it gets with this one.
Yeah.
All right. And how after how long do you see the traits or the signs that someone has this disorder?
Right. When it gets to disorder level, obviously someone would be using the substances. There are some substances like crystal meth. Just a single exposure actually will give a specific presentation. So it depends from one substance to the next, and probably the quantities taken that can determine actually the symptoms that we then see, and then start to classify it as a disorder.
Interesting. I think one other thing that is not normally talked about but is equally important is the risk of then, getting these disorders. What are the risk factors that surround someone getting? So can we call it addiction as well?
Yes, to a certain extent, a certain level of addiction. Yes.
What are the risk factors that surround that?
Now, in other words, you are talking about the underlying issues that cause addiction or
Right.
that cause the disorder. They vary from the probably psychosocial to the actual medical. Psychosocial in the nature that someone probably is exposed to different triggers which someone can't handle. Just for a few examples, could be probably someone is dealing with unresolved issues. It could be family issues, could be business issues, but is unable to cope, and probably starts using substances as a getaway. And then probably someone was abused. Someone can be going through what he can't handle, and then it really probably goes beyond what he can take. And probably someone medically, someone may have undergone a medical procedure and has got to use probably pain relievers, and ends up getting the addiction. So the disorder comes when now someone has got to function using the substance.
In other words, you are ineffective. You can't do anything without taking that particular substance.
And scientifically, probably just a bit of science pertaining to it. Most of these substances are fat soluble. And when they are fat soluble, it then means that when taken into the body, there is biosynthesis, and then post that, actually you achieve the probably your intended, if you are treating, you achieve your treatment. But because of the chemical, like I have said, maybe the chemical composition of the substance, after achieving the result, which is probably a high, what then happens is the body will then store excess as what we call a residue or metabolite in the fatty tissues. That's why I say it is fat soluble. When it's stored in the fatty tissues, what it then means is post-intoxication or post the high, what then happens is the body will then withdraw from the fatty tissues back into circulation. But it's called, they are in what we call sublethal doses. They cannot elicit an intoxication. What they are enough to do is to cause a re-stimulation. So the re-stimulation is just a reminder to the person to top up in simple terms. That's a reminder.
And so that's why you have the urge to then,
yes,
to get more.
Yes, it becomes a cycle. As long as you don't top up, you get the re-stimulation will cause some irritations, some discomfort. That then extends the cycle. If you don't take, you get agitated, and then that's when you start to see the disorder. How is the disorder presented? You start to see probably the mood swings, violent episodes, because there's a desire that is strong inside to top up.
And you can't exist normal until you have a re-up of that.
Either you take the drug or you go for re-up.
Sheesh. Mr. Kavia, how do you handle such situations in your field from a psychosocial perspective?
Well, I think it all goes back to sticking to the ethical practices within our field. Like the good doctor said, that sometimes people find themselves with disorders after actually taking a painkiller within, a proper setup, a hospital. Then they end up with disorders. But it's really a scary process to say someone will not be able to function normally without taking the drugs or taking the substance that they're taking. So when it comes to dealing with, you do find people that come to health facilities trying to buy a few drugs so that they can function properly, but then it all goes to the ethical practices. But we need also to look at the red flags within society, to look at what we need to look, individual in society that are substance suffering from disorders. Normally you find when they are high on their drug, they seem like they are normal. But then you start then seeing things like mood swings, anger, hallucinations, depression, paranoia, and all those things. So really these are kind of the red flags that we need to be looking at in society to see what our people in the society, brothers, young guys, and just try and investigate what really they're doing. Because in most cases, these people will be suffering in silence, and when they take these drugs, they looks like they function normal to them. It's what really stabilizes them. So you may not be able to. It's unlike maybe alcohol, where you can really see that someone is reeking of alcohol immediately. But when they're taking these prescription drugs, you might think they're actually normal. So we really need to look at it and say, be on the lookout for those red flags.
Interesting. Zweli, how do we deal with someone who finds themselves in this mess? Usually, what's the first port of call in trying to administer help on this person?
Okay, so usually since already the issue of psychosocial support has been spoken about, would be to talk to the people around the person. So let's say it's a child, a teenager or young adult, 18, 19 years of age or 20s, 30s. We normally would start by talking about to those around the person, because the typical profile is that this person is in economic perspective. The person is already in about the habit. This person is trying to finance this habit through dishonest ways. Either they are not going to work, they're pretending to be going to work when they are not. We recently had a scenario where a parent got to know after 3 weeks that the guy was not going to college. He was getting up every morning, getting all the allowances, and coming back at the time that everyone else is coming from college, but he's not at college. That kind of behavior. Things were now starting to disappear in the house, and so on and so forth. So you talk to the parents, you talk to those who live with the person, you get to understand more of what the issues are. And here we need to repeat, the enemy, our enemy is not the substance. And I can't say this enough, and I know that you know that that's been my line. Our enemy is not the substance. The substance is not the problem. This problem is out there. It has always been out there. We've always had addicts. We've always had non-addicts. They walk the same aisles of a supermarket. They walk into the same entertainment places. They are exposed to the same substances. They choose not to take them for a particular reason. So our aim is to study that which makes other people want to go there and end up in that particular situation. And other people, while they even work for the brewery and they get 10 extra crates of alcohol as part of their package, but they've never tasted a drop and they've never wanted to. So we come from there, and then we say we've understood the behavior of the person. So we're now looking for what the real issue is. I've said what it is not. So it is not the substance, but it is another extrinsic situation that is forcing them. I was reading something very interesting that where the doctor says to a patient, "What is your problem?" And the patient says, "My problem is alcoholism, is an addiction to alcoholism." And the doctor says, no. The addiction to alcoholism is how you deal with your problem. But what is your problem? And I think that's instructive to say we need to understand that the addiction is something that gives us a red flag about something outside of the substance. Unfortunately, a lot of our efforts, even in rehabilitative health, are focused on teaching people the dangers of crystal meth, the dangers of cocaine, how it damages your brain, and so on. I've never known anyone who is an alcoholic. You go to them and you say, "Alcohol is bad for your health." They say, "Oh, I never knew that. That's news to me." Or you go to a guy who's an addict to smoking cigarettes, and you say, "These things destroy your lungs." They say, "Wow, what a revelation. It's my first time." You know? So there are certain things that we keep pounding on, which in my view are not really the issue. The issue is on the behavioral. So we start with the support system around the user, and then we get to understand, talk to the user. That way we form a picture of what could be the trigger, what could be the problem. Like in the scenario of the doctor who said, "Alcoholism is not your problem. Alcoholism is how you deal with your problem." My question still remains, what is your problem? And we need to keep asking that question. That is my contribution.
I like it. I really like where you're taking this. Zweli spoke about red flags, Doc. At what point because I want to believe, I strongly believe actually that intervention really starts with you. Before anyone else is going to help you, you can help yourself. And there are red flags at each point that you can see, I'm overdoing it now, I'm frequenting this. I'm frequenting the use of whatever I might be using. But could that be a turning point for many? Because I feel like sometimes we just feel like if you're going to get help, it's supposed to be someone else. But can you, within yourself, really, really help yourself when you get to that point where you feel like, no, I'm overdoing this and I need to turn around. Or maybe it's difficult when you are now in the process.
Thank you. I think Zweli has put it right. The problem starts with issues, how to deal with issues.
Right.
No one just drinks like it just goes out of control until there is some underlying issue. Either we are overly happy today, and now we think the best way of getting happier probably is to get more and get high. So that's where it starts. It starts with the other issues other than the alcohol itself or the substance itself. So the issue is we've got to zero our research on there. Expand as much as possible the information base on the triggers, because at the moment we just sing from a hymn book, but what we sing from a hymn book may actually be different from what you actually meet when you meet the actual patients. You realize a lot of information that you generate from them, and you can profile the person and you find a lot of other issues other than what we know that actually exposes someone into it. And you realize at the end of the day, probably this is someone that had a fractural behavioral pattern from childhood. And those fractures are the entry point for substances. So you need to identify those, which are, when I say fractures, each person is born into a family, he's born into a setup, and then there's behavioral patterns that are developed out of familyhood. And when those patterns are then broken along the way due to one reason or the other, that creates an entry for substances in a lot of cases. So we will realize that most of the patients, when you go deeper, I think Zweli will actually witness this. You'll find a lot of other issues other than what we all expect. Each person comes with his own dynamics. And it's important to treat each person differently from the next person. There is no one size fits all in terms of approach. Each person comes with his own dynamics, and then comes the interventions. Obviously, they will differ in one way or the other because of the dynamics that are underlying. This is why we don't specialize specifically on the patient himself. We specialize on the patient in one way, but we look at the other, the environmental issues. We look at the psychosocial issues. Who is he staying with? What is it that is happening there? Otherwise, you treat the patient like Zweli had said, and then he goes back into the same environment, and then the same triggers come, and then he's back. Does he have any personal weaknesses? What is it that he needs to work on? Is it that his business went broke? Because you can treat the drug. It's easy to treat the drug. It's very easy. But the issue of dealing with the other issues, that's the most complex issue, because those are the issues that took him into the drug in the first place. So it's important really to understand that the starting point, when literally you start seeing the symptoms, in most cases it will be advanced, because someone would have been trying to solve issues using the drug probably for some time. And then when you start to seeing the manifestations, really, it means now it is affected and it has fractured certain structures in him, like his behavior, his language, and everything else. When you start to see, it means it has gone on, and now it has had an effect on the person, and it's now altering his behavioral pattern. Because I'm used to him here, he's calm. When we talk, he's very calm. Now he starts shouting. Now you start getting worried. Why is he shouting now? Yeah. It's because he has got now a fractured structure now. There are issues now going on now because of substance that is inherent now in his system. So, and I'll tell you, in most cases, when someone now is in addiction, they can't help themselves. When you start to see the signs, it means now they are not able to handle this. And when you see the signs, it's an alarm that says, I need help at that stage. And in most cases, they can't help themselves. For example, with nicotine is so severe. When now you start to see and to start to smell the nicotine around him, now you know that he's at a stage whereby he can't help himself. The spirit may be willing, but the flesh is weak. That's the scenario.
Yeah.
But you will be cognizant of the fact that this is what's happening to me.
Of course. There's two voices now in operation. There's the right one, and then there's the wrong one.
Interesting.
Yeah.
20 before we get to 11 on Capital 100.4 FM, Mara's Heartbeat. This is the second hour of the Capital Crunch, and we are in conversation on Detox. And of course, we're telling you the most important things you ought to know about addiction. And today we are on substance use disorder. Mr. Karia, I'll be interested to understand setups our environments and how those affect us.
Yeah.
What would be your take in terms of some of the things that we do and we are not conscious to the fact that these are actually, making someone fall deeper, into substance abuse, whatever we might be doing, but but for us it's natural. Yes,
yeah.
Exactly.
Well, I think this discussion has led to a very important point in as far as fighting substance abuse and drug abuse, which is the role of society in the treatment process, prevention and treatment process. The current method, like Zweli rightly said and that the doctor said, really just treating the substance, not the environment. And that's more like preaching to the converted. What we need to do is a structural adjustment of what we call habits and what we call lifestyles that are feeding into substance abuse. I always say we have a way of living for the weekend, and we have a way of turning it into a culture to say every Friday, every Saturday, every Sunday we are at these spots and we are normalizing heavy alcohol drinking because we feel it's the lifestyle, we feel we are belonging to a certain thing. The first point would be for society to acknowledge that within what we call lifestyles and within what we call excursions, we are feeding into this vicious cycle of substance abuse. I always say if people see things for 1 or 2, 3 times, you normalize it. And the problem is within those societies, within those cliques, we are not able to call out each other to say, my friend, I think you have had one too many. We actually create cult heroes within those same setups. But how are we doing? We are normalizing the abnormal. So that's number one. We need to appreciate and understand that we are in bed with a bad habit. And it's coming back to bite us. Before, it's going to be too late when it comes. Number two, society should play an active role in looking for red flags. When I say society, I'm talking about your neighbor, your brother, the person that you live with. These red flags are very important to see. Like the doctor said, by the time you see the mood swings, by the time you see the anger, the hallucinations, it could be a little bit too late. By the time you smell the nicotine, it's a little bit too late. But when society is given information like we're doing right now, we need to go out and look for the red flags and to see that the people that are within our society, are they behaving in a way that, are posing red flags? And when we do that, we then need to look for help, sit them down and talk to them. We also need to adopt a culture of asking and talking, especially men. Men don't talk, men don't ask. I'm bringing this point in reference to what Zweli said, that there is always a trigger behind substance abuse. It could be trying to fit in a lifestyle, it could be stress, it could be, disappointment, whatever it is. There is always factors behind. Swelly always says the bullet, he has a very way of putting it, a very good way of putting it was the trigger is the behavior is the trigger and the bullet is substance. So when we talk and we open up about some of these things, it really works on primarily our mental health when you then talk and you get help. But we bundle up things and we normalize being in certain groups, in certain couches, weekend couches, bottle couches, we get to drugs and we don't really review what's going on. Then it's also time when people were living in society, it's also high time that we also be able to ask questions to say, is everything okay? Just checking up on friends and just trying to find out if everything is okay. Maybe by asking someone who gather enough guts to tell you this is where I am. And when I know this is Q, this is Doc, and we've been friends for a long time, surely you should see the change in our behavioral patterns, in our drinking. You know that maybe Doc's supposed to be drinking once every 2 weeks, and all of a sudden he's drinking every day. That's a red flag. So really, it's about a structural and a holistic change to the role that society plays in as far as dealing with substance abuse is concerned. We need to play a more active part. We're talking about churches, we're talking about schools, we're talking about, social clubs and all that. And we need to remove stereotypes and silos in our society. To say, for instance, it's a silo. So someone is going to come into church and be in church, but suffering from substance abuse. But you cannot talk to them because our silo is, since he's in church, he doesn't do this.
He should not.
That's a big silo.
Yes.
To say it's a silo. We need to demystify those things. People are going through a lot and people are experimenting on these things. And the professional look tells you a certain story, but what's really inside him is different. So when you when you do away with these silos, when you do away with these stereotypes, we are able to start these conversations in communities that can help, especially in church, especially in social clubs. We are able to ignite these conversations, and you'll be surprised on the pulpit when you start to talk about alcohol abuse or substance abuse. You'll be surprised when people will come forward and say, I'm suffering.
Yeah.
But because we have a silo to say, because we're in church, these things don't happen. Because he's a professional, he doesn't, because of ABC. So society should just take that approach, say there are so many silos and so many stereotypes in society that we must do away with and be able to help each other, because the biggest problem is the environment.
Let me quickly patch in Zweli on this one as well. So when we've got cases of people who are recovering and then relapse at a certain point, can we go back to this whole idea of what we have normalized in our setups? And what's the best way for someone who is in recovery to recover without something that would affect them to get back into a relapse?
Okay. So I'll take this at 4 levels, actually. The first 2 levels are on substance use disorders. The other ones are on prisoners, and I'll be using prisoners as a parallel to illustrate my point. So let me start with the prisoners. So I've been involved variously in prison ministry, and in those who are familiar with the legal terms around the Ministry of Justice, there's a term called recidivism. Recidivism is the practice of prisoners recommitting a crime in order to go back to prison because society has rejected them, and society has rejected them because of stigma. Society has rejected them. We can't give you a job because you have a criminal record. This guy is a thief. Be careful when you're around him. Make sure that you count your fingers after shaking his hand, and so on and so forth. And so this guy comes out, he had a capital offense, he had committed murder, or he had committed armed robbery. Now no one will accept him, no one will embrace him in society. So the guy decides, but I know that I was in maximum security and it was difficult, but the guys who had done, had a decent time, and I know the conditions. So he served his 12 years, he's out, and society is just slamming doors in his face. He has tried to get a qualification and do that, and everything is closed. So the guy decides, you know what, I know that if I just do stock theft, steal a goat, I'll be charged for stock theft, and I know the fine will not be more than, the sentence will not be more than maybe 9 months. So you know what, but I know that when I go back there, I'll be among fellow prisoners. They accept me, they understand me, and I have a free meal, I have a shower every day, I have this and that and the other, and it's not maximum security, so it's fine. So the guy commits the crime and goes back. Okay, so that's a type of relapse that I'm just using as a parallel to illustrate the one on substance use. So in substance use, we have something pretty much similar. The disconnect between those of us who believe we are non-substance users, and then we give ourselves the right to point at everyone else as an addict and a substance user, it then gets us to a point where you forget that there are people who are addicted to caffeine. But because it is a legal substance, they drink their coffee, they knock themselves out with their tea, but each time they stop having tea or coffee, they get the same withdrawal symptoms that the heroin addict or the alcoholic gets. They start hyperventilating, they start palpitations, they have headaches, they start sweating, and they have to have their cup of tea with caffeine. So the way we stigmatize the people who are addicted to illegal substances has made us forget that there are those of us who are addicted to legal substances. And so when this happens, a direct answer now to your question. So how do we help this person not to relapse? First and foremost, we've got to instill in them, because it's what is in them that is going to help them to relapse. This whole thing about avoid places that have alcohol and so on and so forth. Yes, I understand it, but he will still have to go into a supermarket and there'll be alcohol there. We need to equip them with the psychophysical strength, the psycho-emotional tenacity to be able to face that trigger. We need to let them know while they are still within our institutions, those of us who are in rehabilitative health, we need to let them know, remind them consistently that it's not that people might stigmatize you when you go out. No. People will definitely stigmatize you, but you need to rehearse, to ingrain and rehearse your response to them, not verbal response, but your response, how you're going to react, how you're going to respond to the way they hit you with this stigmatization, because it is definitely going to come, but your life has to go forward. But while we are doing that, we should also concurrently be talking to society to change. So we're now attacking, we're burning the stick now at both ends. We're definitely going to finish this problem. Because we're saying on the one hand, society, stop stigmatizing people. Society understands that you also have your own types of addiction. Just happens that you are addicted to legal things. On the other hand, we're saying to the user, you will be stigmatized, guaranteed. Do not try and get those guys to not stigmatize you. Work on your being able to achieve your objectives in spite of the stigmatization that you're going to get. So that's one aspect of my answer, where I've talked about the two sides on the two ends. The last thing I want to say is, would it not be nice, Peter and my brother Nkululeko, Dr. Dewa, would it not be nice, would it not be an honorable strategic objective for us to work so hard that our mark of success is putting ourselves out of business? That eventually our ultimate objective is there should be no rehab, because there are no people to be rehabilitated. That our ultimate objective is to be so good at preventative health that we don't need pharmacies, because there's no one who's got a lifestyle disease. That, for me, is the ultimate challenge.
You've been on fire today, Zweli. You've been on fire. I think you've said it all. How do we wrap this up, Doc? I also wanted us to maybe just briefly talk about support of someone who is in recovery and how we should treat it as an ongoing process. Because at some point we just feel like, no, it's fine if you leave them alone. But they need you throughout the journey. How important is that?
Thank you. In order to answer that, I think there's something burning that Zweli has said, which I think I should reinforce on it, because Zweli is in his organization. I love the way the cognitive therapy, he specializes in that, and really I think he has paid visits to our center and actually delivered that, so that it brings to someone that is recovering a certain consciousness. It brings certain tools of use post-rehabilitation. And I believe in our rehabilitative process, cognitive therapy is one of the most critical aspects. And Zweli being the specialist, I can never comment better than him in what he has said. Firstly, I would like to say I attend a lot to churches. I do drug talks. I do actually a lot with the churches. And just as you might know, most of the music players or the worship leaders or anything, they take drugs. It's one thing that we've discovered. And because there's this pressure that comes with standing before the crowd, and they have to be celebs. So there's a certain etiquette they've got to present. You see what I'm talking about? That on its own is a pressure. And a lot of these music players are actually users. And I've had to attend to quite a number of them. So, like Peter said, these silos, if we've got to really handle this, we've got to be very holistic. System by system, we restore it. If you miss one system, what happens is you do a good job on all other systems, then that one becomes the entry point. And that becomes a source of relapses. I think Zweli put it very well. There are issues that have got to deal with the patient directly. There are issues which you've got to address. There are issues that the institution itself has got to provide support. You don't discharge someone into the wilderness. You discharge someone with a structured post-rehab plan. That will help someone to function outside. Because probably to the listeners, to everybody else, rehabilitation is very easy because when they come into a rehabilitative space, they are very acceptable. That's why they are very violent at families set up. They are violent in the community. They come to the rehab. They find love. They find what they don't get outside.
Right.
They find a very good environment for themselves, and they've become very good. You ask Zweli, a patient that has come and with a history of violence and everything else, he comes into the rehab. He's one of the most temperate people in the rehab. Now, you see, it means outside there are certain triggers that are taking place. So it means you need to address the outside issues very well. You need to provide an environment that this guy will be able to articulate properly outside there. And you need Zweli to come in with cognitive therapy. Give him tools, because like he said, he's going to get challenges outside. They are going to identify him and say, Chazoka, be careful, because there is history to it. And one thing I would like to make the audience aware of, we all have got our own dark corners somewhere. The only issue about addicts is that it's in the public domain. You can see it. But for our issues, if we had to really unveil what we go through and what we do behind the scenes, no one would love us. That's the truth. Yeah. But for someone who is addicted, the issue is it's for our eyes. We can see it because it's in our faces. So we should not look at them as different human beings. They are going through this in their own different space, in their own way. We are also doing the same thing. So we need to support these people through recovery. And as the institutions, we need to support them.
Absolutely. Gentlemen, it's been lovely. Thank you so much for your time. And it's always a pleasure having you in studio.
Okay.
Zweli, likewise, thank you so much for your time.
Thank you very much, gentlemen. Thank you very much, and thank you to all the listeners.
Awesome.
Thank you.
And that's how we wrap it up pretty much on Detox for this morning. Stand by. The news coming up shortly.
Follow us on Twitter, Facebook, Instagram, and